Hi, I'm Scott Raymond, Executive Director for Spectrum Management Services Company. Let's talk about something that's fundamentally reshaping the relationship between hospitals and radiology groups across the country. For decades, radiologists and hospitals operated under what we call an unwritten compact. Radiologists provided comprehensive services in exchange for exclusive contracts, essentially subsidizing unprofitable work through their diagnostic imaging revenue. But that model is breaking down, and it's creating significant financial strain for radiology practices nationwide. I'm seeing this firsthand with our clients. Radiologists are working harder than ever. Their productivity has increased dramatically over the past decade, yet their revenue per unit of work continues to decline. At the same time, we're facing a nationwide radiologist shortage that's driving compensation demands higher. It's a perfect storm that's forcing both hospitals and radiology groups to rethink how they structure their partnerships. The good news is there's a path forward. When hospitals and radiology groups approach these challenges with transparency and data-driven insights, we can create sustainable partnerships that truly benefit everyone involved, including, most importantly, the patients they serve. Let me share the economic realities that are driving these changes and how forward-thinking organizations are adapting to create win-win solutions. Today's radiologists are more productive than ever, with average workloads increasing from approximately 11,600 RVUs per full-time equivalent in 2015 to over 13,000 in 2024. And that's just the average. We have found that some private practice radiology groups are upwards of 23,000 to 25,000 RVUs per radiologist per year. Yet despite this productivity gain, revenue per RVU has steadily declined, creating a troubling economic equation for radiology practices nationwide. Compounding these challenges is a nationwide radiologist shortage. Current forecasts project radiologist demand outpacing supply by approximately 5% through 2034 and growing. This imbalance drives compensation demands upward, with median total compensation now ranging between $550,000 and $900,000 annually. Let's look at the numbers. Current market data reveals median work RVUs per radiologist FTE at 10,693, with median compensation per work RVU at $54.43. This translates to median total compensation per FTE reaching $553,861. For specialty radiology groups, these figures are even higher, with median total compensation exceeding $600,000. This creates a substantial economic gap. In our analysis of a typical diagnostic radiology practice, total revenue of approximately $25.1 million falls short of the $31.5 million in provider and operating expenses. The resulting deficit, $6.3 million, represents nearly $200,000 per radiologist FTE that requires hospital support to maintain a sustainable practice. The traditional unwritten agreement between radiologists and hospitals is no longer sustainable. Medicare reimbursement has failed to keep pace with inflation. Emergency department volumes have increased significantly, often with minimal reimbursement. And radiologist compensation demands have risen substantially due to nationwide shortages. Today's successful radiology partnerships require new approaches. Some organizations prefer an aggregate approach with cost-basis models similar to anesthesiology contracts. Others adopt a piecemeal strategy with targeted support for radiologist recruitment, interventional radiology services, administrative roles, emergency coverage, and advanced practice providers. Hospital financial support for radiology groups now typically ranges between $100,000 and $300,000 per radiologist FTE. This varies based on payer mix, service offerings, and subspecialty requirements. Importantly, these arrangements should be viewed not as subsidies, but as strategic investments in maintaining high-quality patient care. By recognizing these economic realities and approaching contract negotiations with data-driven insights, forward-thinking organizations can create win-win partnerships that will weather continuing healthcare challenges. Our team specializes in helping hospitals and radiology groups develop sustainable financial models that benefit both parties. If your group is experiencing these increasingly challenging demands, please contact us to help address this through a renewed partnership with your hospital or health system.